I'm Dr. Mark Sue, and welcome to the Functional Medicine Reality Podcast. Join me and our community weekly as we bring you unfiltered health from inflammation to longevity. Real stories, real people, real solutions. Experience real-life health changes from both patients and practitioners, and learn how to turn cutting-edge information into real results in your own life so you can feel better, live longer, live healthier, and be confident and clear in your healthcare choices. Let's get real and get results. All right. Hi, everybody. Welcome again to the Functional Medicine Reality Podcast. This today is one of our sessions with a patient interview. And again, as a reminder, our intention with these, which we conduct once every 5 recordings, every 5 podcast sessions as a rotation, is threefold. Number one, we are looking to demonstrate live time for folks what it's like to work with somebody in the functional medicine arena, and specifically through RootSeek in our virtual practice. Not all practitioners are the same, obviously, but we take a particular kind of approach. And so we like to try to demonstrate things for people, because the sort of thinking and the communications and the experience with people, because we all know what we're told, or even as referred by a friend to somebody who is touted to be like the best thing since sliced bread, but then we get in the visit and it's not what we expected. And so you don't know what you get until you're there. And so here's our attempt to try to open the curtain a little bit for folks. All right. So number 2 is it is a free consultation for the individual in Joia's shoe, who's just joining us today. So I'll introduce in a second here. So free is pretty cool. And then whether it's a first consultation or if it's a second opinion, if you will, etc., it doesn't matter. Free is free. And then thirdly and lastly is a lot of folks who find their way, find healing in their journey through these functional medicine routes really appreciate the opportunity to pay it forward for other people, and oftentimes like be a voice for other people who are struggling and don't even know about options and they're kind of in the dark, or et cetera. It's an opportunity for the person in Joia's shoe and other past and future patients who will interview on these podcasts to be able to pay it forward in some kind of way or another as well. So that being said, Joia, thanks for joining us. Thanks for being willing to share your story. And as always, as we said just before we jumped on, we have not chatted. Now, we've not done this before. We've not had any visits together yet. This is a first time. You did upload some information for us, so thank you very much, including some labs, which we do routinely with RootSeek, as much as what people want to provide us. So thank you for providing all that, and thanks for playing, as some people might say. Participating, being a player. But I think we have some really meaty stuff to jump into, so let's just get into it, if that's okay.
Yeah, let's do it.
So I said ahead of time, if it's okay, could you just share with me or share with folks like your professional background, because there's a lot of overlap here. So whether a little bit in the past, but also more recently, the last handful of years, and how you got into what you're doing now.
Mm-hmm. Yeah, so I am a nutritionist. I'm a certified nutrition specialist and a licensed dietitian nutritionist. And yeah, I kind of call myself like a functional nutritionist because I did do my clinical hours with a functional doctor. So definitely really like passionate about that world. I own my own nutrition practice called Joia Health, and I got into it because of my own health. I think a lot of us do. But yeah, so I went to undergrad for engineering. And yeah, so very different.
That's pretty different.
Yeah, very different. So I was a civil engineer for 4 years. Yeah, very, very different. I actually took a nutrition class in undergrad, and I almost changed my major, but I had got some advice from family that they were like, "Oh, you're just going to be putting tubes in people in the hospital. Like, what are you going to do with that?" So I didn't go down that, didn't really know a lot about it, but I was always interested in it. And then I think after college, just having some of my own like health issues that I couldn't really figure out, I just like dove into it myself and just started like researching. And then during COVID, when I was working from home, I just had more time on my hands and decided to do a health coaching certification. So I did that, got, my knowledge a little bit deeper there, and just really loved it, and loved like the one-to-one interaction. Like it was very different and felt a lot more fulfilling than like, being in a cubicle doing engineering, stormwater design.
Did you say what stormwater?
Water, yeah.
But I don't know, just on a snapshot, like what does that mean? Are we talking about commercial, residential?
It was mostly commercial. Yeah, it was commercial. It was like designing basically where the water goes. If there's like basically you have to design when you're building a new building, like you have to plan for like the heaviest flood that is likely to happen. Usually it's like in 100 years. So you have to like basically simulate and like calculate where that water is going to go, basically.
No, I'm asking for a reason here. Okay, this isn't just random.
Yeah.
Now tell me, when you say that, okay, and you already know where I'm going with this down the road. Okay, we'll bring it full circle
Yeah.
later. But
Yeah.
so you're talking about for a commercial building, if there's a flood in the town, let's say,
Yeah.
then your job was to like design where does the water from the outside of the building go? Is that right?
Yeah, so basically, like, because when you build something, like, you're putting down a building and then pavement that's non-permeable, so you have to, like, counteract the space that you're taking away for rain to naturally absorb into the earth with, like, stormwater management. So, yeah, it's basically just to avoid flooding. Yeah,
Okay,
but
so the goal is to avoid flooding of the outside of the building.
yeah, or just the building, also just, like, the rest of the city. So yeah, basically because like say you're taking a
Okay,
field and then you're putting a building on it, like that field before was this whole like square footage that was taking water into it naturally. So it's like natural stormwater management, right? Is like
okay.
any natural land. But as soon as you're like building, and everything is like paved, so it's the rain just can't go into it, it has nowhere to go, basically. So you have to
Yeah, but it sounds
somewhere
like
else.
it's more about the outside of the building management than it is inside.
Yeah, yeah. It's more about the outside.
That's what
Yeah.
I'm
It's
after.
more about like big picture, like not causing floods and like, mudslides in.
More for like the town at large,
Yeah,
as
exactly. Yeah.
opposed to the inside of the building.
Right. Yeah. Not for the inside. Yeah. I didn't do anything to do with the inside. Yeah. So you're probably thinking about like
Yes,
molds and stuff like that. Yeah.
yes.
That's
That's
a whole
so
other.
that's like the little egg teaser, if you will,
Yeah. Yeah.
which I didn't even realize. So yeah. So first of all, like, look, okay. So I already
Mhm.
know you're super smart because you're an engineer. Okay, and then you're a civil engineer. All right, and then you like shift gears, and
Yeah.
so I'm tempted to ask you how you find work in nutrition and in healthcare. I guess I'll call it right, healthcare specific, more broadly, and engineering to be similar or not. But I'm gonna shut that down in my head and just
Right.
move forward.
Yeah.
Maybe another time.
Okay. Sounds good.
Because I'm sure that'd be an interesting, like,
They're pretty different, I would say.
over drinks
But,
kind of conversation,
yeah.
but with stuff, reflections. Okay, so why don't we just jump in? Okay, so can you go ahead and just summarize a little bit briefly about like what you gave me in the uploaded information already as to how many years ago, or it's the best that you can say that you started feeling unwell, and what did that look like as a snapshot, looking back, and then kind of fast forwarding between then and now, what's evolved?
Yeah, I mean, hard to say. I think I've always, like, as long as I can remember, had different things, but the more acute issues that have been like, okay, I'm really not functioning now has started in September. So I
Just of
basically,
last year?
yeah, just this past
Oh,
September.
okay, September 2025. Okay.
Yeah. So yeah, it was just like a huge sudden decline. Like I thought I had the flu, but then it just didn't go away kind of thing. So I was just, like my body felt like it was made of lead, had no energy, could barely go for a walk without just like feeling like a ton of pain and just like could not function at all. And yeah, heart palpitations, like really bad neck stiffness. Like I was only really comfortable lying down with my neck supported. Like even just sitting upright was like very painful.
Wow.
So yeah, it was just like, what the hell is going on? And so I went to the doctor obviously and like tested negative for COVID, flu, strep. Was told to go home, wait it out. A couple more weeks go by, went back, and they did order a Western blot and some other stuff. Had a positive Western blot.
So we're talking about Western blot of Lyme disease.
Yeah, right. So I had a positive one, but then the next doctor I saw after that was like, that's a false positive. Like, that's not even positive. Like, we should look at, like, they're not even supposed to order that first because, like the CDC usually has you order Lyme antibody. And at that time, I like didn't want to believe I had Lyme. So I think I was like, okay, like, usually I question things a lot and like, but I think I was kind of going along with that because I didn't really want to believe that that was happening maybe. So the next Western blot was like CDC negative, so I kinda, like, ruled that out.
So you had 3 Western blots.
Yeah, at least. I think I've had
I mean,
more.
in that early phase.
Yeah, yeah. So they all had positive bands, and basically what I learned down the line was that they all had Lyme specific positive bands, but only that first one was like CDC positive.
Mhm.
But yeah, so basically months go by where I'm still not feeling any better.
And may I ask briefly, were they 3 different practitioners who ordered those 3 tests or different or same ones?
Yeah, so it's kind of like a primary care clinic where you see somebody different every time, like it's an urgent care, primary care hybrid type thing. So it wasn't really like
Oh, I'm sorry. I guess what I mean is, the 3 tests you had done, they weren't ordered by the same practice, right?
they were the same practice, yeah.
Oh, they were. You
Well,
had
I had
you
2 by the first practice, which was like an urgent care type place.
okay.
Then I ended up finding like an integrative rheumatologist, and they actually told me, they were like, "Okay, you do have Lyme." This was positive, and I still kind of didn't wanna
And that
believe
was
it.
one of the first 3 tests you had
Yeah,
done?
that was the 3rd one. So the 3rd one was by
Okay.
the rheumatologist, and they also tested me for Bartonella. That one
Yeah.
was also positive.
Yeah.
So then I was kinda like, "Okay, seems like this is what's going on." I also in between that time, I had seen, I'd gone to, like, a naturopath
Mhm.
student clinic. So, obviously, like, you know, their students practicing. He thought I had reactivated mono, which was also another thing that I was kind of like, that was the thing I could compare it to most was when I had mono in college. I was like,
You did, okay.
kind of feel similar, and my EBV antibodies are high, but obviously that wasn't like, that might be part of the picture, but it wasn't like the only thing going on. So I was taking like antivirals and um humic acid and monolaurin and wasn't really helping. So then I kind of figured out, okay, I do have Lyme. And then I found like a Lyme-literate doctor and went on antibiotics and herbals. And
In this case, you mean, because humic acid and monolaurin, because a lot of people don't know, those are,
Mhm.
non-prescription,
Right.
nutraceuticals, and then when you say antibiotics, you're talking about prescriptions now.
Yeah.
So
Yeah.
a combination of prescriptions and herbal antimicrobial herbal antibiotics, if you will.
Yeah. I was
Okay.
also taking like an antiviral for a while, valsiclovir.
So that's a
Um,
prescription, sure.
yeah.
For
Um,
the Epstein-Barr monovirus topic.
yeah.
Yeah.
Yeah. I'm not sure if that really helped, but so yeah, I was on antibiotics for a while. I felt like I was hit by a bus when I first started the antibiotics. Like I actually felt a lot worse, but then slowly started to get better.
Hmm.
Doing a lot better. It's been like months on antibiotics now.
And so overall, can you tell me, like, with those being on with the months on the antibiotic regimen, both pharma, non-pharma, et cetera, overall, after you got past that first hump of feeling worse, what's the overall sort of net outcome?
A lot better, like probably 90% better because I was at like 0, I feel like. I was like totally could not do anything, not functioning. Now I'm like fairly, I mean, maybe not 90%, maybe like 80%. I don't know.
Yeah, meaningful. It's meaningful.
But yeah, like I can go for long walks, no problem. I've started to like exercise again. I'm able to work. I'm able to do most things, but I still am like, nervous to travel, nervous to like push myself at all. Just still like fatigued, brain fog, still some muscle and joint pain. So yeah, that's kind of where I'm at.
Yeah. No, thanks. That's a good. Sorry, and as I was going to ask you, if you can highlight so you kind of just did right there, but just in case, if you don't mind, what are the, say, top 3 challenges for you at this point symptomatically?
Yeah, I'd say at this point, like fatigue, some muscle and joint pain. I kind of notice it most in like the morning and at night. And then like some of those crashes where like I got them really bad before I was treating this at all, where like I would walk around the block and then I would feel like, I don't know how to describe it, but just like my body was like breaking down and like failing. And I do get that occasionally if I like push it too far. But like it takes a lot. That threshold is a lot higher, but I still do get that sometimes, yeah.
So if I could respectfully compartmentalize that under symptom 1 with fatigue, it's just more like acute,
Yeah, it's
intense
yeah,
fatigue episodically, and then number 2 is like the aches and pains, then,
yeah,
do you have
and
a
brain
number
fog.
3?
Yeah, I would say, like, brain fog and, like, cognitive things. I just noticed, like, I can't recall words or like things that I know and stuff like that. Yeah.
Okay. So first of all, thanks for sharing that. And that's rather concise because a lot of times these stories get really complicated.
Yeah.
Part of it, not to minimize it all, but part of it is your story that you shared here is since September 2025, as opposed to say September 2017 or,
Yeah.
a lot of years. So thankfully, for me, right off the bat, just to share, my initial responses, I'm thinking the very first thing is when a person tells me, that the timeline of how long it's been going on is this relatively short. I mean, it's not to minimize it, but it's just relative to a lot of other people. When it's this short, like that's a good prognosis. All right. That's a good sign for good potential of faster turnaround. The second thing that similarly related in my mind is I actually didn't look intentionally or in detail at how old you are, but you're a young person. All right.
Yeah. 29.
On the spectrum of things, you're a young person, and that always bodes well for people. All right. It's not
Yeah.
a guarantee, right? If you got someone who's, say, 7 and autistic, I mean, okay, they're young at 7, but autism's tough, right? But generally speaking, the younger the person, then the cleaner their body and terrain is, if you will. As I like to say to people, we just haven't lived long enough to accumulate more inflammation, bugs, toxins, et cetera, that it's inevitable that we all do.
Yeah. I guess I did kind of leave out another part of the story, if I should recap that too. The other element is that I sent you my ERMI that I just got back
Yeah.
this morning. Did you see that?
Yeah, I did. I did.
Yeah, so the other thing is, like, I've been in this apartment for almost 5 years. It's not like there's no obvious issues, but it was built in, like, the '50s, and, we live, like, a mile from the beach, so there has been certain mold issues. I do feel like I kind of intuitively noticed some symptoms since, like, we first started living here, like, my insomnia got a bit worse, and I would get rashes in the winter, which I never really had before. And I kind of had in the back of my mind, like, maybe it's a mold issue, but I liked our apartment so much I didn't want to move.
Thanks for being real about that, because I mean that's real, right?
Yeah,
It's like
yeah.
it's like how many people is like I know I'm better off without gluten, but like I don't know if I can really be gluten free, right?
Yeah, yeah, exactly.
I know you
It's
told
been
me not to eat the dairy, but like I can't stop not eating ice cream
yeah, the cheese, it's too
or
good.
whatever it is.
Yeah, so, like, I just never tested or anything until now where I'm like, "Okay, I'm at the point where I'm like, I'll do whatever needs to be done. If we need to move, so be it." So and there was a more recent issue too where we found out there was leaks. There was cracks in our bathtub that was leaking below the tub, and there we got mold inspector, there tested it, and there was Chaetomium, Aspergillus, and penicillium under there. And, we're renting, so, like, the landlord doesn't really wanna do everything that needs to be done, obviously, so, yeah, and that leak has probably been going on for a long time, and we've also had some, like, moisture issues. The first year we moved in, it was a really wet winter, and we didn't have heating because it's like San Diego. The landlord was like, "Oh, you don't really need heating," but it was kind of a chilly year, so we had like little electric heaters, but there was just a lot of condensation on like the walls and windows because how wet it was, and there was some mold like growing on the walls basically.
Or you could
So
see
that
something. You could see something suspicious.
yeah, so we, like, basically cleaned it and dealt with it ourselves and did come back, like, to a lesser degree the following year, then didn't come back. So it kind of depends on, like, the weather and
You mean the visual stuff could come and go?
yeah, like, it
Huh,
would come back
without you guys cleaning it?
no, we cleaned it, like,
Okay.
really thoroughly, but
Oh,
then it came back the following winter
yeah, got it.
because of just, like, the humidity, I think, which I never, like, paid attention to how humid it was inside. Now I have, like, little humidity monitors, but,
Yeah, because I mean, so you just since you've stated where you are in the country, being San Diego, like that's not a reputationally or stereotypically, it's a pretty very it's one of the possibly one of the most temperate climates in the
yeah,
country in terms of year round
exactly.
temperature, right? It's like
Yeah,
every day is sunny and mid 70s or something like that, right? I
mhm.
mean,
Yeah,
people aren't thinking San Diego equals humidity, although
yeah,
those people who are in San Diego know, like, well, it depends on which of the 3 areas of San Diego you're in, like around the shore, in the mountains, in between, right? So I don't
yeah.
know that for sure, but if you can back up a second, I'm curious. I'm really curious about your comment there about, hey, even from the first time we moved in, I was kind of suspicious, right? Or you said I kind of wondered even before testing all this time. And so you voiced that one of those reasons for suspicion was something like rash and sleep troubles, right? And I'm kind of interpreting that to mean, hey, it wasn't like, yeah, I'm not crashing, I'm not dysfunctional, I'm not intensely symptomatic, but it's just not right. Right. But again, it's easy to kind of just keep on moving, right, in life because it's not holding you back. But was there anything else besides, these small symptoms, or is it just, would you just say it was like an intuition, or was it something about smell, or did you actually at that time even know about mold related illness as a condition? And did that play a role in why you had a suspicion about it, or?
Yeah, I mean, I knew about it,
Oh,
because
okay.
I was, like, in school and working at, like, a functional clinic at that time, so I definitely, like, saw patients who had that, but I never thought about it as something that affected me because I feel like it's one of those things that, like, you're like, "Okay, other people are sensitive," and, like, that's a very specific issue, but, I mean, it is true that, like, most people can probably tolerate a certain amount of mold because it's, like, everywhere, and have no issues, so I just kind of was, like, chose not to believe that I was one of those people that had problems with it because so the first winter we moved in, we'd had the visual mold issue that we, like, cleaned and took care of and everything, but so I knew that there was mold, but I just was kind of like, "It's probably not really a problem, like, it's just, we live in a coastal area, just kinda happened," but in the back of my mind, I was like, "Could this insomnia and, like, rashes be connected to that?" So, I was just kind of, like, in the back of my mind because had seen that it was there, but I didn't know, like, how extensive it was or anything.
So if it's okay with you, I'd love to just pause just for 1 second and sort of, well, I said prior to us jumping on, but I'll say again. So truly, I'm sorry you've had to go through all this stuff with a lot of the symptoms you've had. I mean, you're young, you're living a vibrant life, you're obviously brilliant being an engineer, all right? And then now like, okay, things kind of fell apart, right? And it kind of feel for a lot of people, you can correct me if I'm wrong, but I'm pretty sure you'd feel the same. Like a lot of people like, this isn't fair. It's not my fault. What I do deserve this, a lot of that kind of thing. Then you throw on top of that, you didn't really describe this way, but and maybe part of this is because maybe you're just bright and educated enough that you are, I guess, especially as an engineer, I'm being stereotypical here, but, looking at being able to sort of like, think about things methodically and analytically, and maybe you can step back from it and kind of go, okay, so, hey, let's just attack this kind of methodically, if you will, but, but hey, look, when you tell me, when you tell me that you were tested 3 times for Lyme disease up front, all
Yeah.
right, and given effectively three different interpretations, okay? Or like, I mean, the far majority of people from my experience, they're just like, what the frick? Do I have it or do I not? Like, right? And also like, what is going on with the system here? Like, how come you guys can't agree? And why is it so complicated or confusing, right? And then you throw on top of that, someone else is like, yeah, and you got chronic or reactivated mono with
Yeah.
EBV. Like, well, that makes sense because it feels the same. But then what about the Lyme? What is it? Is it Lyme? Is it mono? Right? And then you threw in, oh yeah, and then there's a Bartonella. It's like, what the heck is Bartonella? And like, what's that about? Right? So I mean, you were faced, I'm reflecting that in observation and validating for you, you were faced with this complexity kind of quickly. Okay. And I'm not shading that. I'm actually, this is just the reality of what happens especially with this kind of scenario with your particular set of symptoms. And for practitioners who look at multiple topics at one time, which is kind of more our approach, at RootSeek. It doesn't have to be, but it's our default. Now it does introduce the potential of quite a lot of confusion and certainly a lot of questions. Okay. And my guess is, again, being an engineer and having some background in this and having seen it, in the healthcare profession, both in your training and in your own profession now, in your own work, I should say, with your own clients. My suspicion is that, okay, you can glide through it a little bit easier than other people because I think a lot of people, when they're thrown Lyme question mark 3 times and then Bartonella and mono, and then now you throw in there the mold thing, a lot of people are kind of like deer in the headlights and going, whoa, 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 like, oh my God, I'm so lost, right?
Yeah. 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 It's
I
very
mean,
confusing.
does that relate at all? Or are you like, no, actually, I didn't feel that way?
No, I definitely did feel that way. Like, I was really confused, really frustrated, really, like, angry also when I figured out that it was Lyme and it'd been months that I could have been treating it from when I tested positive to when it was actually like confirmed because of the doctor who said it's a false positive. Yeah, it's really confusing and it's unfortunate that you have to like really advocate for yourself. Like I feel like I had to become an expert on it myself just to like get the right treatment because nobody seems to be in agreement about it for some reason.
Yeah, and I think we could, for your sake especially, and for the sake of making this a higher yield experience for yourself, we won't get into, unless you want to. It's totally up to you if you want to. But yeah, those nuances about interpretations of different tests, like each item you threw out there, all right, um, between Lyme disease, Bartonella, mono, and mold-related illness. I like to call it mold-related illness. Some people just call it mold, but I get a little technical there. So we got, I think I counted 5 there, all right? 5 sort of sub-diagnoses or
There's more.
contributing root causes, right?
There's even
Right.
more actually.
I know there's more. I know there's more. But, right off the bat, we're looking at like, okay, so this is a great example for me. It's just another scenario where a lot of times when we come across stuff on whether social media, podcasts, whatever, people are always regularly talking about, look for the root cause, look for the root cause, look for the root cause, right? Well, 2 questions come up inherently in what we're talking about here. Either number one is like, well, which one is it? Right? A lot of people are going to ask that. You may not as much because I think because of your kind of training, both as an engineer and then now, in the healthcare world, much less in functional medicine world, it's a little more, it's easier for you to adapt. I'm pretty confident, to recognizing, okay, commonly not just one thing, right?
Yeah.
It's a multifactorial issue. And the difficulty becomes, well, which ones are the bigger dog players? Which ones are playing more of a role? In your story, sort of, I have the benefit here, as a sort of, in retrospect, where you say, yeah, I got 80% better treating the Lyme topic. Okay, well, obviously in hindsight, that was a big player, obviously, right? But if we were starting anew at the months ago and looking at these 5 or more topics, how does one really decide, which one to, because you can't do everything at once, but we're not gonna just, talk through that for the sake of exercise and for fun, because that's not important for you. So,
Yeah.
but it is for you and I as professionally, we're in the same realm, in the same arena. That is an issue. That's a real challenge, no doubt.
Yeah, nailing down like what is the main problem. But
Well,
yeah,
where do you start, right?
yeah. Yeah, because I think it's definitely multifactorial and I think you just realize that working in healthcare too, most things are, but especially with this kind of stuff, it's like all of them are working together and kind of affecting your immune system together. Yeah,
Yeah.
makes sense that you have to do it all together in a way.
So let me ask you here as we kind of move this towards trying to put this into actions plan for you. Okay. You're moving that direction. Next question here is so you've talked about your bigger symptom challenges, right? Fatigue, pain, and brain fog. And let me just say this now in case I forget later. It's not like this is guaranteed for everybody, but it's pretty predictable from my experience over a lot of years that fatigue and brain fog are commonly the last 2 things to go.
Hmm.
They're commonly the last 2 things that improve enough or resolve, right? If a person starts out with 20 symptoms, and for anybody who might think that's crazy, that's, you and I know that's not that terribly uncommon when, they're just often suffering in silence because everyone else thinks they're crazy. But, if someone starts with 20 symptoms, I'm going to put my money heavily, bet on the last 2. They're going to be the last bastions and holding out, putting up the fight last. It's going to be fatigue and brain fog. All right.
Okay.
So, if we were to take the time here and list out other symptoms you had or have, it doesn't surprise me at all. Bottom line is, it doesn't shock me at all that of your 3 top symptoms, fatigue and brain fog are in those top 3. All right. But aside from that, what kind of top end questions do you have right now for, to help yourself move further in the healing journey?
Yeah.
Either to clarify like confusion and questions you've had to date, and or questions right now with data that you have, et cetera, and or what you're doing for treatment to move forward.
Yeah. So I guess one thing I'm nervous about is just coming off of the antibiotics because I've been on them for months now and planning to come off them like this month or in the next month. So yeah, just like what else I can be doing, with like herbs or supplements and treatments that can hopefully make sure that goes smoothly and that my symptoms don't come back and rebound. And then yeah, my other questions are like I've been treating the Lyme and bacterial infections. I didn't mention I also tested positive for strep and brucella and rickettsiosis, and those have like been positive from December to now. So I don't know if those are like they're not going down with antibiotics or what, but yeah. So like I've been focused on those infections, and now the mold is more top of mind, and just figuring out what to do about that. Like I'm leaning towards moving at this point because I got the ERMI back and it was pretty high, and I just think, if it's just one more assault on my immune system, I don't really want to risk that. But also just like, do I need to get rid of everything? Do I need to should I be looking for only new builds? Yeah, just kind of your opinion on all that too.
Okay. Thanks for that. Yeah. Well, so with that in context now, you okay if I sort of spout a more at the risk of coming across a little rash or quick to judge or impulsive, but having looked over the info you provided me and then the information you just gave me right now, this is sort of like a first draft thought,
Yeah, yeah.
response as far as where you're at now and where to go forward. Is that okay?
Yeah.
All right. So yeah, so in comparison, or just putting your experience into context compared to a lot of other patients, right? You've actually, as I said, and I say this in a positive way. On the one hand, a lot of patients might, in your shoe, might be going like, okay, this is really confusing. This person's talking about Lyme. This person's talking about Bartonella. The Brucella topic, the strep topic, mono, mold related. Like it's just crazy. There's too many avenues and directions here, right? And from my experience, a lot of patients who have all that these sort of targets and these diagnoses, they were solicited and identified by a variety of different practitioners. All right. And without going into more detail about that, for your experience, you talk about there's an urgent care setting, there's the primary care setting, there's an integrated rheumatologist, which is really rare to find, but okay, great for you. That's awesome for you. And there's probably other people involved. Oh yeah, you got the naturopath who you're working with, more recently or still now. So there's at least 4 there. Okay. Maybe there's more, but yeah, that's a kind of common experience, right? Because different practitioners start to look for different things. And sometimes that's because that's what they sort of specialize in or focus on, or sort of like their niche branding, or their niche, what they just are personally stimulated and interested in, on an academic level or whatever. And then of course, part of it is just inherent that when you work with the next person, they can look back on what you've already done and they're not going to repeat the same thing. They're going to more often than not, tend to look elsewhere, or sometimes they might validate, whatever direction you're on. But, there's more likelihood that you're going to collect more diagnoses as you go along if you're not getting better. And that's why you're seeking other opinions commonly, is because you're not getting better enough anyway. Right. So, that's just a common experience. And in your case, you were just, from my POV, as the young people like to say now, okay, from my POV, you were more fortunate, in my opinion. It's a little confusing for people commonly, but I consider it more of a good thing that you're able to you're able to collect or identify all these different targets in a relatively short amount of time. Okay. So here's why. So bringing this all home, for us at RootSeek, what we tend to do is we model it like AI. All right. If you want a clear cut and comprehensive and, more spot on response to whatever question you're throwing in, you got to give it a lot of input, right? If I can't give it one sentence and one question, expect it to spit out exactly what my mind is thinking about. I got to give all the circumstances, different elements that I can think of, and then I get a really robust and much more nuanced and meaningful response that fits more hand in glove with what I'm looking for, right? So the more data that we collect up front with testing, the more you get a well-rounded picture. The downside of that is it opens the door for more confusion, right? As we've already just talked about, we don't need to reiterate. It also, of course, takes a little more time to do all that testing, and not uncommonly, some more money, because not all tests are insurance covered. But we're going to sidestep that for a second. But here, this is a common story, for a common scenario for us, where patients have done some work, with usually more than 1, 2, 3, sometimes 7, 8, 9, 10, 12 different practitioners. And we collect that data. Or if someone's totally, really, unusually just haven't had any testing, then we'll do this like kind of large battery, or at least as a default, okay, including the labs you've done and then some. And we're splitting those 3. So now we're going to get just a little technical, not necessarily for you, but I don't think. But we put all the lab results into 3 categories, right? So this is how I would group out your results, okay? I mean, basically everything you talked about fall into one category. All right. And no doubt we could go through even more of your results or talk through more of your symptoms and talk about the other two categories. But everything you talked about falls under the category of bugs and toxins, right? Environmental exposures, okay? Strep, tick-borne bugs with either Lyme Borrelia or Lyme Bartonella, the monovirus mold from your environment. These are all things that you didn't make. Your body didn't make. They're not like, they're not inherently like friendlies. They're not familiar to your body. And so anything in that bug toxin realm, like anything that comes from outside your body, has the potential, doesn't mean it's going to, but has the potential to provoke a response, i.e. inflammation, right? Anything that your body does not recognize and comes into contact with, especially at higher amounts and for larger, lengths of time, your body has to make a decision, right? And regulate it. Like, hey, you're okay. We're going to leave you alone. We can coexist. Or, hey, you're not so okay. We're going to have to fight back. We're going to have to do some work, right? And that's inflammation, provocation and response. Okay, so the second category, and we won't go through in detail, but the second category is basically what I just said. It's the opposite. It's everything that comes from you. It's your self, right? Self and non-self. With the self, the biggest topic we think about is immune system, okay? My sort of fun phrase to people is, if you don't have an immune system, you won't suffer because you're not going to have inflammation. You can't mount a response. You won't be able to mount an inflammatory response, so you won't suffer. You'll die. You'll die really fast, but you won't suffer on the way to dying. On the other hand, if your immune system is too hyperactive, well, you're more apt to suffer with even small provocations, right? Even that small whiny voice in the bus is going to like drive you totally nuts, as opposed to the other person they can tolerate 20 people being annoying. Okay. So the immune system, but you also got your hormones, and you got your, people talk about the mitochondria, your nutritional profile, your genetics, the list is on and on. Okay. The third category, just to round it out, is what we call the interfaces. It's the first meeting point, the first contact point between yourself and your non-self, the outside world, the bugs and toxins. And really that comes down to your skin, your gut, and your respiratory system. All right. And so the gut, I always like to throw out, and this, it's estimated that the average person has more bacteria just in the colon alone, which is the smallest segment of the, between large intestine, small intestine is a small section, but there's more bacteria in that colon alone than all the cells in our body combined. Right. So they like outnumber us. We're basically being used as carriers, as a vessel for all these bacteria.
Yeah.
Right. This microbiome that everybody talks about. They're not all bad. We need a lot of it. But, that there's a lot of freaking regulation going on in the colon, right? And we better be able to do that decently well. Okay. So then we do we put all the tests into these three categories, and then we're looking at, okay, so where do we go from here? Well, as we already said at the beginning, you can't do everything at one time. Okay. So you can't attack all the things that if we're looking at all these things at one time, we're not going to treat like all 5-year topics all one time. All right. We're going to make a decision on what we're going to attack first. Some of that can be really personalized, which we don't have to necessarily talk about in great detail with you because, and I'll explain why in here a second, but it's the decision-making on the exact sequence. Okay. That's the key. That's the real key, if you will, the special sauce, if you will, if there is one, for how we think about things at RootSeek, is what is the sequence? It doesn't mean there's only one sequence. There isn't just one combo that's going to open this lock. Okay. Many combos would work, but the goal is to help you get better faster. So some combos are going to open that lock faster than other combos. We'd rather take the short route, not the long route. Okay. For the sake of reducing suffering. In your case, you've already given a head start. You're like, hey, I'm like 80% better with the antibiotics, right? So Fantastic. Kudos to who you've been working with. Fantastic. Glad that they, gave credence to the lab results. Awesome. They've selected a, obviously an effective regimen for you, pharma, non-pharma, whatever the case may be. I know you've said you much prefer non-pharma. It's curious to me, like how you okay with doing the pharma, but hey, that's cool. Whatever. You've gotten 80% better. Okay.
Yeah. I was like, at that point, I was like, I'll take anything.
Yeah, whatever. Just help. Right.
I definitely have a preference for not. Usually I would not want to take antibiotics unless I really need it, but I was, doing so badly that I
more
was
desperate.
Like, I'll do whatever. Yeah.
Yeah, and that happens a lot, right? I mean, ultimately we have our preferences, and it's awesome that you're, well, I assume, that your practitioner asked about it or talked about it or you took it into account, but and that's a very nuanced decision, between pharma and non-pharma. I tend to use both, our practitioners, we tend to use both. We're all comers. It's basically the best of both worlds and the best tools to just help you get better. And as you get better, you can kind of wean down and be more selective about the preferences and other stuff, right? So let's just say this, and this is why we don't have to get real nuanced about your sequence because we've already been given the head start. Okay. But historically, I'll say historically, among the functional medicine world of practitioners who tackle and treat these more complicated cases, okay, because as I think you know, functional medicine is commonly like divided into sort of what one colleague of mine calls functional medicine light, and then what we call the chronic complex world. It's easier to work with, and it's not to be whatever. There's no value judgments here. It's easier to work with people who aren't as sick as you've experienced before, optimizing wellness, prevention, health, milder symptoms, et cetera. The complicated people, again, you've come a long way in a relatively short amount of time, all things considered. So fantastic, really happy for you. But for those of us who work in that arena, commonly the two big dogs that people talk about are Lyme and mold, right? Lyme disease and mold related illness. We're not going to talk here about, go into the background about defining those because some people, those terms are sometimes used a little bit loosely. And then each topic on its own is super complicated. There's all kinds of subtopics within each one. Lyme disease is broadly used for a bunch of different kinds of bacteria and parasites, and mold illness, you got to divide it into the mold toxins, the mold inside of the person, as well as the mold in the environment, if there is some, okay, et cetera. So you got to break it down. But in your case, on a high level, it's very clear. It's obvious. Okay. There's no argument here. If you've gotten 80% better on the Lyme therapy, okay, and if there's question about the mold illness at all, then if you hadn't already gone down that road, that's got to be that's by default or analytically for most practitioners, that's going to be a question. Okay. A lot of Lyme focused practitioners, and I'm not, again, no shade here, they might be more like, keep pounding the Lyme topic. Hey, you're getting better, you're getting better, you're getting better. It's just going to take time. And we're just inching, because it's getting the last bit is always the hardest, right? Finishing the last mile and a half marathon, whatever, is always hardest. Losing the last 5 or 10 pounds out of 40 is harder than the first 10, 15, right? So it's easy to pound that, but I'm convicted, I'll just speak for myself, and it trickles down to how we approach things at RootSeek, that looking broader at the other topics is higher yielding than just continuing to dig deeper on any one topic. All right. The key is being sure that we're clear on diagnosing any other topics and not just kind of like overreaching on diagnosis. All right. Or just like shooting from the hip and guessing. Okay. But in your case, and this is where we're going to get down to the meat and potatoes here, right? So I think, I'm inferring from what you've told me, you haven't been treated for any mold illness topics yet. Okay. So there's number one, right? If that's an issue, then you've got like high yield to be had, I'll just say. Let's just get right to the point here. You sent me just this morning by email the swipe test you did at home that you references. So a lot of people know that term ERMI. Okay, there's a lot of different ways you can test your environment, but the dust swipe test, not the one the kits from Home Depot and Lowe's and whatever else and online. There's specific kinds. Okay, they assess for these mold, not the mold toxins themselves actually, but the mold species. Okay, that are clinging to the dust. And that's what's being assessed for in the lab testing for these dust swipes. So my question to you is, obviously you can see from the ERMI score that it was the highest, level of finding. But do you have any familiarity already prior to now about these scores, like from your training before or anyone else?
Nothing from my training, only from actually joined a Facebook group that was like San Diego Lyme and molds because I
There you
was
go,
looking
Lyme mold, right?
Lyme doctors. Yeah, I didn't really know that they were connected or think about the connection. And that's what kind of made me revisit the mold topic. And yeah, I've seen people talk about Hermes in there, and then I did some research on it. But yeah, I
Okay.
didn't have any like prior experience with it.
Well, here's the shortcut. All right. The ERMI score has a more potential to look worse or look better than it really is. Okay. It's a logarithmic kind of calculation. You would understand that better than I as an engineer. Okay. That's
I
still a long
forget
ago.
about
I don't want to talk
that.
about logs and math. Okay. But it's like a magnifying lens. All right. So I'm not saying that's not an important score, but for me, two labs that people tend to use as practitioners in this realm of care are the envirobiomics and mycometrics. And I think yours was envirobiomics.
Yeah.
Is that right? Okay. So both those labs, they print out on the subsequent page that you no doubt saw another score it's called the HERTS-Me2.
hmm
They're all acronyms. And the HERTS-Me2 is basically a subset of the ERMI score. Okay, there's 5 strains of mold species that consist of the total hurts me too score and pulled out of the ERMI as a total. And I won't get into the history of it just for time's sake here, okay, as to what that's all about and why. So you mentioned in your intake form, that there's a question of SIRS or mycotoxin illness, right? And so mycotoxin, again, as a reminder here, mycotoxin just means myco means fungal. So now we're talking about fungal toxins because we have the fungus. Fungus consists of yeast and mold, 2 types of fungus. Both yeast and molds can make toxins, all right? But yeast doesn't so much exist like in our environment. Mold does, yeast not so much. Inside the body, yeast is, if you made me pick one, I'm going to say yeast is more common than mold, but both can exist inside the body, okay? But all of that stuff, both categories of bugs can produce toxins under stress, all right? And so that's why there's a little difference in the terminology. SIRS, chronic inflammatory response syndrome, as you already know, no doubt, it sort of connotates a specific thinking and approach to patient care where it's sort of this is just objective, like that's what it is. The definition is we don't really talk about treating fungus itself. We're just treating the inflammation that your body is mounting in response to, by and large, fungal toxins. Okay. And then we can extend from fungal toxins into bacteria that's in our environment as well, which people don't talk that much about, and a couple other pieces. Basically, an unhealthy environment, okay, an unhealthy indoor environment, and then the inflammation that our body is mounting in response. Whereas the other sort of non-SIRS category of practitioners, if you will, they do incorporate treating fungus, okay, as well, fungus in the person, okay? And we're not going to get into details of when you do that or why, because that gets too nuanced, and that's a big topic. But that's the big differentiator. Okay, SIRS and what I like to call it SIRS plus, just meaning like, hey, the way I approach things, and at RootSeek, we kind of like it's a hybrid. All right, it's a hybrid, but we're not sticking to like a more regimented protocol of the SIRS protocol because number one, we do treat fungus, and then number two, we're not necessarily having to commit to completely going through the whole entire SIRS protocol because quite frankly, I just haven't had to. When we treat a broader spectrum of topics and both individually and then as a team through RootSeek, we just haven't had to go through to the end of the SIRS protocol. All right. But
Okay.
bottom line for you is that hurts me too score that you have.
Yeah.
Okay. That score of 38, that's the highest score I've seen in at least 2 years.
Oh my God, really?
Yeah. So I don't say
Wow.
that to gaslight you,
Thanks.
right?
Yeah.
If you've listened back to, or because I know you've heard some of the podcasts before, or watched them before,
Yeah.
like when Mike Schranz, Dr. Holmes, Dr. People, right? He's the IEP, right? We work together on the board for ISEAI.org. It's about mold illness is our bread and butter from that organization. We talk about that all the time. We don't want to gaslight people. We're regularly trying to help people kind of be ungaslit or diffused a little bit. Okay. So I'm not gaslighting you, but I'm being frank with you that I haven't seen a score that high in a long time. And for me, the borderline result is like 11 to 15, right? Under 10 is considered like decent. I don't know if I've ever seen I don't think I've seen less than 4. I don't think I've ever seen 2. Definitely have never seen 0. I've seen 4 rarely. 6, I'm like, wow, that's really good because I don't even see 6 that often. Borderline, I see a lot. And then if I see 16 or above, which is in the high category, then okay, yeah, that's legit. If I see over 20, I'm like, that's a 1 eyebrow raise. If I see like 26, if I see over like 24,
Way past that.
yeah, if I see 26, I'm going like 2 eyebrow raise. And I'll tell you, I don't know if I've seen over 40. High score you can get is like 50. If I've seen over 40, I can't remember, but I've probably seen over the years 3 or 4 people with scores of 40. Mike, no doubt, would have seen, and people in his shoe, they would have seen a lot more cases than I have, obviously, because that's what they do, full time. But 38 is really high. All right. Now, just to step back from that for a second. Number one, so I'm going to get real pragmatic with you. Number one, the analytical side of me. And so I assume the engineer side of you will resonate.
Yeah.
Especially where you're like, I second guess things. I do that all the time. So we're in the same boat. All right. We come from the same fabric. Right off the back, I kind of go like, okay, what's the likelihood that it's kind of like an overreach, like false positive, or, it's the result is higher than it really is accurately? Well, the first thing is, and we don't have to get into necessary details here, but how could that happen? The first way it could happen is you collected too much dust. All right. It's not real standardized as to like the instructions on how much dust to collect. And, that it's more of like a community of practitioners, best practice, common practice kind of hearsay, if you will. There isn't the test kit company has its described logistics and methods of testing, collection, all that kind of thing. But regardless, putting that aside, just for argument's sake, okay, even if 38 is off and it's a little too elevated, I mean, I'm not banking it's going to be below 15, right? I mean, that's too great of a discrepancy. Okay.
Yeah, there's no way.
It's more like, for me, the difficulty is when I see like a 15 or 14. Okay, could it be a 12? Could the 12 be a 10? That kind of thing. That's tough. Okay. And to be fair, a lot of times what we're doing with this dust testing is it's a screen. Okay. Because I mean, if we're sure the person got at least a certain number of square foot of collection of dust, and the score is like a 6 or 8, all right, I don't know how far we're going to push that, to retest or have an actual IP go in there. Okay. And like go looking and expecting them to have sort of like radar glasses or something like that. I mean, it's not to say without merit, but there's question about that. Okay. Now, in your case, let's just jump into it. In your case, it's a different story because you're renting. All right. And we've had plenty of cases, collectively as practitioners or within RootSeek or just me individually in our brick and mortar practice. We've had plenty of cases where it differentiates between, do you have control over assessing and doing something about your environment, or do you not? Right. If it's your workplace, like, you pretty much it's the same thing as rent. You don't have say really strong, meaningfully in where it's taken. And of course, this is all about money. It comes down to money. So the landlord or the building owner or the workplace or whatever else it may be, the employer, they're not so likely to. It's very unlikely they're going to take it, as seriously as you are, right?
Yeah.
And I think that's not. I'll be honest with you, I don't even know if I don't judge that, right? Because number one, I just described for you, like, okay, so hey, in a court of law, the first question is, well, who collected that test? Oh, I did. Are you a professional IEP? No, I'm not. Well, that doesn't mean anything. All of a sudden, that means nothing, right? So that's why if you're looking at legalities, and you've got to get a professional in as the next step, and of course that has its own questions and uncertainties that we're not going to get into here right now. But for you as a renter, yeah, as our local ICI, inspector likes to say, you've got some difficult choices to make, is what
Yeah.
is her wording. It is when it's someone's own home. Okay. But for you, hey, one of the nice things is you have an opportunity to just decide to leave, right? If it was your own place and then you kind of go, wow, it's pretty meaningful, then you're going, okay, well, it doesn't mean it has to be break the bank cost for remediation, but you're already looking at, okay, what is it going to look like to do the remediation?
Hmm.
You got to take responsibility of that. But in this case, you could just leave. Now, I'm not saying that's just trivial. You've already said you like it there. You
Yeah.
really like it there. So that's where the decision comes into play. But my suspicion from what you've already said and the degree that you suffered is, okay, now that I've kind of like let the cat out of the bag that 38 is really high.
Yeah.
I'm pretty confident you're already like, okay, I was kind of thinking about it already, but if you're telling me it's that high, then okay, I'm kind of
Yeah.
there.
Yeah.
Decision's kind of like, I'm kind of there already. It's like I might have to adjust a little bit and settle into it, but I don't know if there's a lot of decisions to be made. Now, just FYI for me, we've written letters for people, many times, because if a person like really wanted to stay and they want to ask their landlord to look into it and all that kind of thing, and I've been involved in those kind of cases too, either with patients or colleagues, and just help them out. Okay, colleagues as they are their own patient, if you will. It's just really variable, and you just don't know what you're going to get. Is it, how likely is the landlord really going to look into it at all? Are they going to downplay it? How contentious does it get? What kind of personality do they have? That kind of thing. Because when it starts to become a bit of a conflict, when money's involved, it's easy to create conflict, and things can kind of go south kind of fast.
Yeah.
So that's a decision you'd have to make. But we have written letters for people to sort of help them get out of those leases. Like if someone had another 2-year lease, then, but you're like, as we say, living in mold, that's not so awesome. Then we gladly help people, write people a letter. And we're not just trying to like, scam the system or whatever. I mean, it's a legit thing. And they don't want to deal with this becoming, more contentious and conflicting and much less legal and all that themselves.
Yeah. Yeah.
Now, I'll pivot for a second here. All right. So moving from your environmental test, and let me just make a quick comment about your other tests that you've uploaded for you. You're testing you versus testing your environment. Okay. When it comes to testing you, and I'm assuming I think I only saw it once with the SIRS markers.
Yeah.
It's
There's
evident to me that the
specific
person who drew
markers.
ordered the testing, they are familiar with the SIRS protocol because they ran the SIRS markers, or at least a good number of them, right? The common ones that I would run typically.
Yeah, I actually ordered those myself because I It
Okay,
was
then.
just like I was getting my blood drawn anyways, and I had been researching, and I was like, I'm just gonna add these to my order.
Okay.
So, yeah, I
Okay.
haven't reviewed them a ton.
Okay.
Yeah.
So for me, there's I think just broadly speaking, I'll just
Mhm.
say, first of all, when I look through, let me back up to the Lyme topic, right? So we hadn't talked before, so when I'm looking through these, I'm like, that's interesting because I know you said you've been, on the paperwork that you've been treating for Lyme. I had no idea how much benefit you made or not, but quite frankly, I was kind of anticipating that you wouldn't tell me that you had that much benefit.
Really?
Right? So, it's not to say that I'm not at all saying you don't have Lyme, but the mixed picture and at the risk of creating more confusion, all that stuff, right? 'Cause,
Mhm.
Lyme testing interpretation can be nuanced, which is why a lot of practitioners sort of don't love getting caught up in that, okay?
Yeah.
Understandably, I'm not whatever, it's just what it is. Yeah, you have some markers, but it's not flagrantly or intensely bad, right? As you already said, there's a lot of them that
So
are
good.
quote unquote CDC criteria negative. I mean, even CDC criteria aside, even alternate or alternative interpretation results by the criteria of those labs, there's at least one or maybe two that were negative, and then the one that you did most recently in I think it was January of this year. Yeah, January this year. There's markers there, but the far majority of them are in the sort of mild moderate range as opposed to the high range. They're orange instead of red. And then,
Yeah.
the number of markers, especially for like Borrelia, all right, for Lyme, I think there's only two, if I recall off the top of my head, two markers, which again, for me, I'm not a stickler to the criteria and official guideline interpretations, et cetera. But, just all in all, as a flavor, there's a lot of sort of qualitative and artful, mindful interpretation of a lot of this stuff. As a totality with your results, it's like, yeah, there's some there, but it doesn't scream at me.
Yeah.
And
Yeah.
also your IgG antibodies, that are the fuel for the markers, they were adequate. So I can't even blame, like, you don't have enough markers there in your immune system to show us the results. So I couldn't even use that as an excuse. So I was like, yeah, it's there, but you've been treating. I was anticipating you weren't going to tell me it's like been a high yield. So I'm happy for you that it has been. And this
Yeah.
just is another example of yeah, it's not all that black and white. All right.
Yeah.
But
Yeah.
then similarly, when we flip over to the mycotoxin and SIRS world, okay, yeah, when I look at some of those markers, like some of them of the four or five I can remember off the top of my head, like a couple of them fit the bill and a couple of them don't, right?
Mhm.
And so, but regardless, when you have a hurts me too of 38, I'm like, it doesn't matter to me what your inflammatory markers look like. That's not a pretty picture, all right?
Yeah.
And
Okay.
then when you tell me now, hey, I've been on antibiotics for quite a while, I've got an 80%, benefit, and the plan right now is to start weaning down. I'm like, okay, well, if that's all the case, then it's an easy decision. Like, yeah, it's time to shift focus into this mold topic, right? Whether you continue the antibiotics or not, besides the easy thing of saying, well, I defer to your practitioner, but it's not a straightforward topic, right? The nice thing though, for me, if I was to counsel you on this, I would say, hey, if you go off and you worsen, you can go back on it. It's not like a commitment that you can't walk back through that door. Right? You just and I want to validate your experience, your comment. And I appreciate you sharing that to say I'm kind of scared to go off of them.
Mhm.
Even with the context, like I don't like pharma, but I'm on pharma antibiotics, and yet I'm scared to go off of them. That's totally legit, right? And
Yeah.
you can imagine people who've been on antibiotics for like 3 years, okay, for Lyme, and they're like, I'm not going off of that, right? I mean, or like they're even more entrenched in that mindset, understandably. But
Yeah.
there are ways to, yeah, you can easily just decide to taper and wean a little more slowly, or you can overlap, right? This is all part of the sort of sequencing of things, or it's just the pragmatic decision making. Okay, if we start addressing the mold topic, if you will, the toxins, the inflammation, the et cetera, then you may find that you're gauging by symptom reduction or you're gauging by some of the markers that were abnormal. Okay, that things are better, and then you start to wean down on the antibiotics at that point. That's another option.
Yeah.
Okay. A lot of people find, and and then I'll shut up here for a second because I've just been monologue here. The uh, the way I think about for me commonly, in this case, it was just the nature of the circumstances. You treated the Lyme thing first, and then now it's the mold topic coming up. Okay. If you ask me as a default, I commonly go the other way. All right.
Mhm.
Largely because from where I stand, the mycotoxins, those toxins have a lot of immune suppression functionality. And so the toxins can both cause inflammation and reduce your immune system functionality and sort of like lessen its ability to fight the battle. So if we address that first, then I look at that almost like a 2-for-1, whereas treating the Lyme topic is sort of like a straight 1-to-1. Secondly, on top of that, okay, in both cases, it's like something that's perseverating, right? If you've got like Lyme disease issues in your body, then it's in your body. Like you can't really just pull it out, right? It's going in, and so either optimizing the immune system to fight the battle and overcome, which I just don't know if I've ever seen somebody just like treat immune system alone. Okay. Whether it's through various immune system therapies we have, pharma, non-pharma, peptides, et cetera. I don't know that I've seen that yet. Okay. But I've known people tout those stories, but you have to go after it. Okay. The mold topic, if it's an environmental exposure that has been identified, it could be, there are times that you can get a kind of faster win in time regards if you're able to be removed, right? Or address it. Now, addressing it is the harder part, right? If you owned it and you had to address the environment, then that's going to take more time, right? I mean, just the logistics, like assessing it and then having remediators and all the steps and blah, 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 it's going to take more time. But in your case, like if you had the opportunity and ability to kind of like step out, then you get a kind of fast win because it kind of disconnecting the exposure of the environment from the person is key. In Lyme, you can't really just remove that exposure of the Lyme inside you. With the mold topic, you're constantly exposed. There's at least potential to disconnect, and all of a sudden that can be a faster win.
Yeah.
All right. And you already said in your intake form, like, I felt pretty good that time I think you said you were in Hawaii after graduating, right? Or something like that. I mean, you're like, I feel pretty good there. Like, okay. And I don't know if you were living where you are now at that time or no?
No, I was still in Boston. Yeah, so was went to school in
That's not
Massachusetts.
related to your current environment.
No, but, yeah, I guess that is, like, the thing, like, these more acute things have been since September, but I've definitely had, like, long-term issues that I don't know if, like, some of these infections have been longer term, like, that's what
Yeah.
I wonder too
Usually,
if
almost always they are. Almost
really?
always. Yeah, almost always. Like, it's not like you just suddenly got hit with 5 things in the last, less than a year.
Yeah,
It's not. Like, this is what happens in, in the big picture here. This is what happens in these situations is it's a cumulative, it's an accumulation over time. Okay.
yeah.
The mono thing, I mean, it wouldn't shock me if you told me it was a pretty meaningful case in college.
Yeah, it was bad. I, like, had to leave and go home for at least a month,
Yeah, that's more severe,
taking
right?
competes on my classes.
Yeah, that's a big deal. And recurrent reactivated mono can play a meaningful role. And I won't go into it, but like I myself am just personally more and more, unfortunately, impressed with how meaningful it can be with, I don't know if you caught the podcast session with my wife who's a researcher at Harvard and all the stuff. There's a lot of mono sequelae and consequences that are, even more brought to the forefront now. So the
Yeah,
mono thing is, it doesn't, when you tell me like, hey, it felt kind of like mono, like, yeah, that's not surprisingly part of the story either, but that's
yeah,
not new, right? Um, so bottom line, when a lot of people, when they have that experience, like when they go on vacation, even for a week, much less if they're
mhm,
gone for a month from their environment, they can tell they feel better, right? And that's just an example of, yeah, it's predictable that if you step out and look, even if you stepped into a place that had some mold, but the score, like hurts me score is like 14,
mhm,
still would put down money that you're going to feel better. Like
mhm.
14 is way better than 38.
Yeah,
Okay.
mhm,
So that's the thing. You have more opportunity to feel better faster with the, extracting from the environment exposure. And then, by doing so, and then if, just by doing a couple steps, which, we can touch on after the fact here, by helping your body sort of eliminate some of the mold toxins more effectively.
yeah,
And there's a couple ways of doing that, enhancing your own body's ability to eliminate, or using, what we call binders to kind of mop up the toxins and you poop them out. Okay. Then you can, you can get that 2-for-1, and your immune system pops in a little bit more, and then yeah, the 80%. Uh, if you're already 8% there, living in the environment you are with a 38 score, like that's a really great prognosis for you, in my opinion.
okay,
Right.
that's good.
And then the last thing I'll say is, back to your other comments, like Brucella, like I'm not, for the sake of just on a high level, it's not
Mhm,
some. I don't know how much I would put a lot of concern and emphasis on that, especially where you've been on antibiotics for a period of time now already. The
okay,
strep topic, eh, like when we do those those functional stool tests,
mhm,
basically everybody has some kind of strep there. Okay, it's usually not the kind. I think yours was a strep A, which is less typical to see in the blood, but again, you've been on antibiotics again. So is it really still there? I don't even know, but it's not something I would put a priority on right now. And then the mono topic, lastly, on the collection of 5 that we talked about here, the mono topic, again, touching on what I just said like 2 minutes ago, that one I'm ever more put I put ever even I put I've never put so much focus and effort, intention on addressing that than I have in the past. I've never put as much focus as I do now than I ever have in the past. But
Hmm.
that's a long-term thing. Okay. There isn't, number one, I don't know how predictable it is that staying on antivirals or even giving your immune system boosts in specific ways that we know, by principle would help treating viruses specifically. We don't have a great way of assessing accurately and accurately how effective it really is. Okay. And then B, I just happen to know that the people my wife are working with in the research, they've got some tools in hand to address the sort of autoimmune second life direction that the mono instigates and drives as an independent factor of inflammation. Okay, that treating the virus won't do anything for. They've got some tools already. They just have to fine tune it. And I don't know. I mean, there's already a prototype out for one other autoimmune disorder that's not related to EBV, as far as I know. But I put hope that for those who I've had people where we see their markers go down that you referenced, their mono EBV markers, the antibody levels. Okay. I see that happen, not uncommonly. But does that really play out into symptom reduction? Hard to tell, okay? Because these symptoms are often kind of subtle and mild, like fatigue and brain fog. So we can, for me, that's on the back end of the sequence, because I don't know if I really ever see people have short-term symptom reduction from treating viruses. It's basically never a front-end sequence for me. Not to say I leave it alone, but it's rarely in the front of the sequence. I save that for later and just say, hey, if you're like 95% better, you're not even on antibiotics, you're out of a mold environment, you're not even using binders, whatever, 95%, like fantastic, and you're like, I just need to take a break. This has been what a last 2 years or whatever. Okay, fine. I still would say, hey, you're not gonna have side effects with the antiviral therapies, and I would just think about that as at least a couple year thing, and then reassess, and things will change in terms of our knowledge base and our tools at hand to treat these kind of things, especially on the autoimmune direction.
Yeah.
But that's something that has potential for more longer term chronic and accumulative impact that I'm more aggressive about now. Even with teenagers, college students who have an acute case of mono, I'm pretty aggressive about that now. And I treat that for a reasonable length of time after they're symptom free even.
Okay.
Okay.
What do you treat that with?
Well, I personally, I do use the valcyclovir a lot. Okay, a pharma. It's so well taught. I don't know if anybody's ever had a side effect. Knock on wood.
Yeah.
It's just never happened. I love using TA1 as a peptide. All right. And I won't go into reasons why, but like I love that. It's just for people where it's a little too expensive for them, that I'll at least use Pure Encapsulations, a supplement company makes one called TH1 support. I'll use that in lieu of that. For people who don't want pharma and they want to go, the direct antivirals. So the TA1 and the TH1 support are boosting the immune system, right? The TH1 side of the T lymphocyte immune system boost, that is what attacks the viruses, right? And then the valcyclovir is like reducing the virus itself, right? If they don't want to do valcyclovir because they want to do herbals, then sure. I mean, I use oregano oil a lot, and then I'd be curious on another time if you tell me if you learn anything about this, but I encourage people to not eat eggs. It's kind of like a hearsay thing about, but I don't know how well it's
Yeah.
documented, but there's a lot of clinical observation over a lot of years that, or at least hearsay, but I when I surveyed this through a practitioner email group a couple years ago, a couple people like actually told me like they were keeping data themselves over 8 to 18 patients a piece, and
Mhm.
it was pretty compelling. So I mean, look, it's not a hard thing for most people to like not eat eggs, for a set period of time. It's not like
Mhm.
forever.
Mhm.
So that's kind of like my regimen go to.
Okay.
And then
Cool.
I apologize, at the risk of dragging this out a little bit, I do have to make comment. There's 2 other things in your health profile that I'll throw out. Actually, maybe 3. One is, so you're a carrier with the hemochromatosis.
Yeah, I wanted to ask you about that too. Yeah, because I have one copy of that gene, and my iron panel on this last round was really weird. I don't know if you got to see that. I could
What
tell
date
you
was
what
that done?
things are. It was the 23rd, March 23rd.
Okay, thanks. I'll take a
And
repeat on
it's
that.
called Blood Work 2, I
Yeah,
think.
I see it
Yeah.
now. Yeah, okay. Yep. So yeah, so Look, iron can go high under times of stress, right? Ferritin, as you know, it's a, we call it an acute phase reactant. So when people, if you had the flu, like your ferritin could be really high, doesn't mean you have excess iron. In your case, you do have some high iron, outright iron, not just the ferritin. I was going to just say, even if I didn't remember those, even if I hadn't looked at those numbers again right now, the fact that you are a carrier for hemochromatosis suggests the likelihood that you're going to have some, at least iron overload, as it's often called now, right? At
Yeah.
least iron overload. A lot of people have iron overload without having even a carrier for hemochromatosis. The bottom line is too much iron, is oxidizing. It can be a reactive oxygen species, et cetera. It can be, it can contribute to some inflammation. I don't know
Yeah.
how much I would make a huge thing of it other than to say, hey, this is part of the hand of deck card you were dealt with in your wiring. I don't know how much you can do about it other than, people might do phlebotomies to keep their blood levels low, but it's just to say, hey, the way I account for it in an individual like yourself is, hey, if you're not making more progress faster, that could be a player. That could be a reason why. And okay, maybe we just want to just recognize that, acknowledge it, and be okay with it, right? Or do we make some effort to try to, phlebotomy or whatever? Okay, so that's number one. Number two is, hold on a second. Let me
The
look at
other
it.
weird thing was the ferritin was really low. So if you scroll down,
Yeah.
ferritin was only 14. So it's like, why do I have such high iron but low ferritin?
Yeah. And I think that's not necessarily straightforward for me
Yeah.
an explanation either. But in this case, the iron for me supersedes the ferritin in terms of assessing do you have higher iron or not, right? Because ferritin can be high for other reasons, but iron is iron.
Yeah. Yeah.
The other one is the factor Leiden.
Yeah. I just found out about that.
Okay, so that's just you're a little bit more at risk of the clotting,
Mm-hmm.
right? That
Yeah.
or what we call sticky blood.
Mm-hmm.
Okay, so I don't know if you know the term hypercoagulation or sticky blood.
No.
Okay. So that's a bigger topic, but we'll address it. We throw in 4 out of the 20 some markers that someone could throw in just to look at sticky blood, but we commonly will look at that as part of our default assessment, in RootSeek. And I just haven't seen a lot of patients over the years that maybe there's reason, I don't know, but I haven't seen a lot of people make meaningful symptom progression just treating the sticky blood alone. Message to patients is that sticky blood, which is, so I prefer to use sticky blood, and hypercoagulation is just too technical and medical of a term. Okay, so I
Mm-hmm.
like to use the word sticky blood, and I prefer sticky blood to clotting because when I say clotting, people get really freaked out, understandably, right?
Right. Yeah.
If I say clotting, all of a sudden people are reaching for their calves, wondering if
Yeah.
they can have PET, or they start thinking am I going to have a heart attack or a clot in my lungs, right? And I don't want to freak people out. So because usually what we're talking about is more that it's just kind of there's in some ways it might be more sludgy, the blood flow, but mostly what I think about is the blood vessels in your tissues, let's say a blood vessel in your muscles, okay? The intention is to transfer oxygen nutrients from your blood vessel into your muscle tissues, right? But if you've got extra plaque and stickiness and stuff that's just kind of it's almost like mini plaque, if you will. I get a little hesitant to, gaslight people, but think of it as mini, really thin plaque. But it just reduces the ability to transfer these nutrients and oxygen more effectively to your tissues like your muscles or in your brain. Okay, so yeah, that's something that, so in this case, again, it's part of your wiring. You can't do much about it, but we will sometimes be more aggressive or more intentional depending on if you're willing to take that many things at one time as far as treatments, to use biofilm busters or proteolytic enzymes, protein breaking enzymes, proteolytic enzymes, right? These are ones that can break down these mini plaques, if you will, right? And sometimes again, it's not overnight or after a week when you're oh my gosh, that's it. Something just kicked in. No, it's not going to be like that. It's going to be subtle. It's going to be gradual. So again, you just got to fit it into, okay, what all are you doing at the same time, and how much are you willing to do at one time, et cetera. The last piece I'll throw in, and then I promise I will shut up. The last
This
piece,
is great.
the last piece is your ACE score,
Yeah.
right? And we don't need to get into details of that, but
Yeah.
there's reason we ask for that for everybody up front with the adverse childhood events, right? And trauma and stuff like that, because a lot of people who struggle to make progress and a lot of people who have these chronic complex inflammatory conditions, much less don't get better faster. It's very commonly observed that they have an ACE score, or, if they haven't done the survey, that they've experienced. Look, we could argue who hasn't had some degree of like negative life experiences or broadly defined trauma, or at least micro trauma, right? Been bullied a lot, or just berated all the time, et cetera, et cetera. There's a lot of different types, but that it's just if someone's not getting better more meaningfully, or they're just so stuck and they're just not making any progress, like that's definitely like fast climbing the list as something that might need to be addressed, because the sort of like mind body effect, even though the person's not thinking about things, they're not like hyper vigilant, they're not reliving memories and stuff, but there's a reason that book is called The Body Keeps the Score, right? And there's true science around the mechanism of inflammation driven by these, what a lot of people call hidden, trapped negative emotions, right? And there are ways of addressing that as well, whether through, we'll broadly call plant-based medicine as
Yeah,
a
yeah.
newer evolutions these days, but there's a lot of, and it doesn't have to be all like uncomfortable and conflicting, like opening the wound and scab, like talk therapy. Not to say it's not helpful, but just to say there's a lot of different options. So those are
Yeah.
all thoughts for down the road, right? Right now, in summary again, and I stop here easily, and I just have the benefit of you having been treated to point. Mold focus, Lyme continuing on some level up to, just how you kind of wean that over time, okay? Or keep it in place or not, or trial off and then come back if you need to, all right? More down the road, you got the virus topic, and you got the A-score trauma topic of consideration, right? The virus topic for me is like a low-hanging fruit. It's just taking things and keeping it go for a little while, okay? And hopefully we see just the numbers come down. If you recover like 100%, okay, and it's not a high enough intention, motivation, et cetera, on the A-score trauma topic, like, hey, that's at your discretion. But if you just can't get to the finish line, definitely that comes into play for me, at that point, certainly. And then in between, the sticky blood and the iron are considerations.
Okay. Okay, thank you. Yeah, another I don't know if I mentioned it, but MTHFR, I also have that
Yeah.
also.
So, basically, from my observation, I've made it a habit to test like anybody in my primary care setting, I'll test that for. And the far majority, I think I would say 80 to 85% of people have some MTHFR abnormalities. It's not really like an unusual thing at all. Historically, years ago, the functional medicine community was really hopeful that this was going to be a big aha moment, and help people with detox and all that kind of stuff, right? Detox, all et cetera, et cetera. And I'll just never forget. I don't, by now, at this point, it could have been 8, 9. I don't know if it's been 10 years ago. Maybe, was it during COVID or not? Because it was a virtual conference I was in. But let's say it was more than 5 years ago for sure. All right. And this was a big conference. I don't remember exactly who. It might have been the IFM. And it was like a breakout room. And the guy leading this breakout room as a designated presenter, if you will, was a psychiatrist, a specifically psychiatrist, and he was all into the whole psychiatric genetics and all that stuff. And I just never forget. He just was very transparent. He was like, "So I just got to ask you guys, how often do you guys see people actually have symptom change, like treating MTHFR abnormalities with methylated folic acid and all that? Even at the high doses, the 5 grams and all that stuff." And the consensus among the group of, I don't know, there must have been 6, no more than 8. Okay, but 5 to 8 people, pretty much to my recall, I don't remember anybody saying like, yes, I do. It was either wishy-washy, meh, mid. And he was like, yeah, me too. We thought this was going to be like this big breakthrough, and like,
Yeah.
I don't
Yeah.
know.
Yeah.
Now, again, I still think there's value. I'm not minimizing it. It has
Yeah.
value on some level, but I don't tell anybody that they're going to feel a difference.
Mhm. Yeah.
It's a smaller player in the
Yeah.
totality of all the topics for me. I will grant to you the whole methylation and genetics stuff, in functional medicine, that is an area that I have not tapped into. I will acknowledge that. Okay. That speaking of engineer, I always tell people as my fun comment, I was like, that feels like engineering to me, and it's so complicated. I don't have the bandwidth right now to step into that still after
Yeah.
several years. I just don't feel like I have the bandwidth. I'm sure at
I
some point
like
I
it.
will, but
Yeah.
so I'm open to being corrected.
Yeah, no. Yeah, that's interesting. Yeah, because I did a, like, full genetic panel
I
on
saw that.
myself recently,
I saw that.
and yeah, it was just not just the MTHFR, but a lot of, like, impairments in methylation, a lot of impairments in detox, especially,
Yeah.
like, I have 2 deletions for a glutathione transferase enzyme, so they're just, like, totally deleted, like, not there. So I think that definitely probably impacts my, ability to detox and maybe why I'm more susceptible to some of these things.
Yeah, there's some things like that that are more obvious for me.
Yeah.
And then the nuances, of course, I don't even recognize or identify or understand. My encouragement to you though is that given, this kind of totality of story of elements we talked about, the hemochromatosis piece, the factor Leiden topic with the sticky blood, this the various detox mechanisms, and much less the glutathione transferase being kind of like absent almost. I'm very heartwarmed and meaningfully impressed that you've made this much progress this quickly, right?
Right.
That's really good.
It doesn't feel
That's
quick,
really.
but it does.
It
I
doesn't.
mean,
I know it doesn't feel quick to you, and I don't
yeah,
mean to. I'm not devaluing or
not at all. Yeah.
but it's a pleasant surprise for me again because we didn't talk
Yeah.
before this.
Yeah.
So it's meant to be an encouragement because if you've gotten this far with those kind of like cards stacked against you, if you will, the
Yeah.
prognosis is like excellent to me, right?
Okay. Yeah.
And you
That's
have
really.
various pieces you can modify and refine what you're doing,
Mhm.
and you're well on your way.
Thanks. Yeah. Yeah. And on the ACE, I'm doing EMDR as well, which I think is helping a lot.
Yeah,
So yeah. But in terms of like the mold, besides getting out, what else would you suggest as next
sure.
steps?
Yeah, we could land on that one, as a so like that's a good final piece there. So if so we could do this after the fact, but I'll just list you options of what I use. For people who aren't pharma, then it's really like for copays or whatever, then there's colesevelam as a pill form and there's cholestyramine as a powder. They're kind of similar, not exactly, but they're kind of similar. Again, they're insurance covered. They're both FDA approved for lowering cholesterol, which I know you mentioned you have like quote unquote high cholesterol. I didn't look at your exact numbers because a lot of people see that it's flagged as high, but it's not really high, especially for their age.
Well, yeah, mine, it's it's only been slightly elevated, so I didn't think I had the gene. It runs in my family, but this past time I got it, it was super high, like in
Oh, I
like
see.
370,
Yeah, yeah. Look at that.
which
Those are
it's
really
never
high.
been. It was only in the low 200s before, so I don't know if it like could it
You mean the
be
total?
yeah, the total,
Okay.
but now it's like super high. So
Yeah. So I will say this is this. So and this is even conventional medicine. It's just no one ever thinks about or talks about this. But those cholesterol numbers can be inflammatory. Like they can be like inflammatory markers. I don't look for all the people I see every day year round with labs for physicals and stuff. Like even if that's the case in principle, I'm not going to tell you that I see this regularly. Like people who have the flu, I'm not seeing their total or LDL numbers be 30 points or more higher than the baselines, right? So but having said that, I actually have had one scenario where I had it not nearly as high as yours, but I had some really unusual numbers as well, just one time. And I know that we had some highly suspicious mold exposures in our home at that time as well. And I didn't actually do anything about it. And then it kind of returned to baseline later. Most people probably say, oh, it's probably a lab error, but
yeah,
it's
maybe it was like
possible.
inflammation. Yeah,
It's
that's what
possible.
I was gonna try to just wait and see if it goes down again.
Yeah.
But yeah,
Yeah, so you got the cholestyramine and the colesevelam as prescriptions, and then on the non-prescription side, for me personally, I mean, there's a lot of options, right? I mean, there's a lot of stuff online that I don't even recognize the name of the company, et cetera. But like on the simplest side, a lot of people use charcoal, and that's pretty easy, cheap, and et cetera. For me personally, I end up using a lot of, I don't know if you know Cellcore as a supplement company.
yeah,
Okay, so I use a lot of their biotoxin binder. I haven't had to use carboxy that often, which is touted to be the stronger of the two, but I use a lot of those. And in past, I've used quite a bit of ultra binder from Quicksilver. In the more distant past, I've used. I know some people as patients, they told me they just on their own digging they were using diatomaceous. Is it called diatomaceous earth?
diatomaceous earth, I think.
Diatomaceous earth, I think. It's been so many years now, but I recall that from some patients. And then, yeah, I won't. Once in a blue moon for someone who's just mild or they just want to be really more minimalistic. They just don't want, or maybe it's cost or whatever. Like sometimes we just go with fiber, like just straight up fiber supplementation. And now one of my more favorite ones actually also is that. Do you know the SBI Protect or Mega IgG 2000? Two different companies.
Yeah, yeah.
So the raw ingredient's the same, right? Immunolin, and
Mhm.
that has been identified, scientifically to be able to bind mycotoxins also, which is
Okay, cool.
it just
Yeah,
makes it all the more of a multifaceted, like love that product kind of thing.
yeah, yeah. Okay, great.
Treating the fungus is more difficult, right? Treating fungus inside of somebody, I commonly will go pharma at least as part of the regimen for people, but it's commonly a multi-element regimen, kind of like treating Lyme, and I commonly will use pharma with herbals in combo unless the person adamantly wants to go just herbals.
Okay. Yeah. So more of like a antifungal
Yeah,
thing?
so I've used a lot of fluconazole, which doesn't seem to exacerbate the liver tests, basically hardly ever, if not ever. Terbinafine, the Lamisil, generic Lamisil, that one is I use that one quite often, and then the other one I use often is clotrimazole, which is they're like troches just on the tongue. So if people have thrush, it's even more effective for the thrush than the other ones, I find. But it's a little annoying because you have to take multiple, it's not just like a one, it's like two twice a day or something like that, and people don't seem to mind it though. A couple of people actually told me they liked sucking on them and letting them dissolve. I don't know.
Okay.
Um,
Yeah.
those are probably my most commonly used three. I won't explain now how I choose them for person to person, but those are my common
Yeah.
three. And then in
Okay.
the non-pharma world, um, I use a lot of colloidal silver.
Mm.
I tend to use the Argentine 23 version, which is like the professional version of Sovereign Silver, I think is the direct to the public version. So they're very similar. Um, colloidal silver, and then I do end up using um, Candibactin AR and Candibactin BR kind of often, and then I lean on neem as an ingredient, the
Mhm.
herbal neem, which for
Yeah.
me I just end up using a lot of a product from Cellcore called Cytoimmune. So I use
Okay.
that. I use that a lot, and I'm missing one. Oh, biocidin. I end up using biocidin quite a bit too.
Okay. Yeah.
But those are probably my most common.
I've tried to do well, not tried, I have done, like, parasite cleanse. I did a cell core parasite cleanse a few years ago. That one went pretty well, but I tried, the candida cleanse, and I was taking biocidin, and it gave me, like, a rash immediately. Do you think that was, like, more of an allergy to the ingredients or more of, like, a detox reaction?
Just statistically speaking, I tend to presume that when people have skin reactivity to supplements anyway, I tend to presume it's more of a reaction than it is more of a detox reaction, if you will, more than it is an actual allergic reaction to some ingredient.
Yeah. Okay. Yeah, I was living here, so maybe.
Yeah, I think that it's very arguable that that's the case with a lot of prescriptions too, right? This is documented in medical literature. The number of people who have a listed allergy to whatever antibiotic commonly, and then they're retested for it and they're fine.
Mhm.
It's a
Mhm.
pretty meaningful number,
Yeah.
right? Which raises the question. You could say methodically, analytically here. Well, okay, so did their immune system change and they're just, they're okay with it now, or was it just that it wasn't really an allergic reaction to the medication to begin with? We just made that assumption.
Yeah. Yeah. Interesting. Trying to think if I have any more questions.
Yeah, I mean, I know I just kinda, like, spit out a lot of stuff at you, so hopefully it wasn't, like, overwhelming.
No, no. Yeah, it's really helpful. Yeah, it's helpful to get like your confirmation on the molds because we did go back and forth a lot about it. And I think seeing that the Ermi and hurts me, like, okay, this is like a real thing. But even just hearing that that's the highest you've seen in 2 years is crazy. Yeah, would you say like at that level we should get a new mattress and couch and all that?
Oh, thanks for reminding me. So, yeah, so if you go to, this is gonna sound like a plug, but look, it's a nonprofit. This is so ICI, right? ISEAI.org. If you go to that page, and then go to the, Get Help tab, and then
Okay.
under the Get Help tab, look for the, I think it probably says IEPs or it says environmental professionals or something like that, as opposed to the practitioners, like clinicians. If you go to that page, there's a few free downloads,
Mm-hmm.
right? Like documents that have been created by the IEP committee. They put a lot of work into this stuff. They've got some really great content there, and it's free. And one of those documents is, I think they call it toss or keep,
Yeah.
which is like it's kind of like what you're asking about.
Yeah.
And then
Yeah.
there's also a document about remediation, like steps, of consideration. Yeah, some of that's a nuance, and I'm not gonna tell you I'm like totally up to date on all that stuff. My bandwidth is I'm human. My bandwidth
Yeah.
is has some
Yeah.
limitations, and I've chosen to have an awareness to a certain level, and then at that point, I defer to guys like Mike and his, people like him.
Yeah. Yeah.
And a lot
Okay.
of times they do. So a lot of those folks they do virtual consultations.
Mm.
Right, great.
Okay.
I mean, Mike does, other folks in our IEP or the, ICI organization, a lot of folks do that, and especially in a scenario where you're talking more about, it's not like I need you to look at the environment and swab sample it or whatever else. You're just looking for advice on how to handle, content material or whatever else, things of that nature. That's very, very, feasible to do by virtual consultation. That can be highly valuable to people, just for some reassurance and some guidance and direction.
Yeah. Okay. Thank you.
Yeah, good stuff. Look, again, I'm really encouraged by your story.
Okay.
I'm, pleasantly surprised, but that's awesome. And, a lot of it, you've done a lot of great work. And so look, if people want to reach you, as a nutritionist and having familiarity with this kind of stuff yourself, right? Because that means a lot. So tell folks how they can reach you.
Yeah. My website is Joia Health, Joia health.co. My Instagram's Joia Health, and my email is hello@joiahealth.com.
Cool. And you're taking folks?
Yeah, I am. So I was not taking new patients for a long time when I was sick, but now I'm starting.
That's why I asked. Yeah.
Yeah, yeah. Now I'm starting to take new ones, but yeah, mostly just slowly taking people on, not doing anything crazy, but yeah.
Great. And I just remembered what I was thinking about a second ago. I
Mhm.
know there are more than one, both IEP inspectors as well as remediators who are in the ICI organization and know their stuff, who are in your area. So if you actually needed someone in person for any reason, or just whatever, and just wanted to be able to touch base in person, then you have options. And again, through the ICI website, under the Get Help page, you can find people. You can find who they are on that website too. So look, it was a lot. We went for quite a long time here. I was not
Yeah.
expecting that, and so thanks for hanging in there with me.
Yeah.
And hopefully the health information was helpful and not confusing.
It's really helpful. Thank you so much for all the insight and knowledge.
Yeah, no, my pleasure. And appreciate your willingness to share your story. And again, yeah, for whether it's you or anybody else listening, there are plenty of other people who out there who don't know what they don't know. And these are awesome opportunities as free consultations, and they don't necessarily all go this long. In your case, it was just like so much already, so it was easy to kind of like pull in more. And again,
I've
I
been
I presumed with your intellect, being an engineer, that you'd be able to handle even more information kind of like tagged on, at the periphery.
yeah,
So
yeah.
thanks
Yeah,
for
there's
bearing
so
with me.
much, but yeah, no, thank you.
All right.
Yeah, it's great to meet you.
Yeah, you too.
Yeah.
We'll call it an end here. Yeah, for folks listening in, then as I just mentioned, if rootseekhealth.com is how you can reach us as a virtual practice. And if you have never worked with a practitioner before, or need a different look and whatnot, then our team is more than privileged and honored to walk that journey with you at whatever level. And ultimately, our goal is just to help people get better faster. Until next time, we'll call it a day here. And thanks again, Joia.
So fresh, just the way